Cases have now spread to a new county in New Mexico. One New Mexican has died of measles, a child. In West Texas, the South Plains of Texas, 223 cases. Child has unfortunately died in the state of Texas. My question is simple. Yes or no, do you believe the measles vaccine is safe?
Yes.
Yes or no, do you believe the measles vaccine is the most effective way to protect against infection?
It is, but if I could mention, as we discussed last night, and I think it's important to remember, CMS really should not be opining its own opinion or sharing its own thoughts on vaccines. Our job is to follow the rules. So if the CDC is making decisions about the use of a vaccine, and that's what's agreed on by the experts there, my job, if it confirmed, is to make sure we pay for those vaccines, seniors and for children.
Now, my colleagues and I have written twice to the Secretary of Health and Human Services to do more to address measles. There's not been a response. The same question asked of you today, if confirmed, would you respond to letters from members of this committee? I appreciate your strong response. Yes. It might surprise the American people that Senator Kennedy or Secretary Kennedy said the same thing. So, Mr. Secretary, if you're watching today, respond to the damn letter. People are dying. I'm going to get back to the questions, Dr. Oz. The next question I had was to ask how many people need to die before the administration takes it seriously. I'm not going to ask you that. But I would like to enter into the record an article from The Atlantic detailing the story of a Texas father who just lost his daughter to measles, Mr. Chairman.
Without objection.
Now, Dr. Oz, I believe Medicaid is on the chopping block because of the Republican budget. And Mr. Chairman, I would like to ask to enter into the record the Republican budget resolution which passed on February 25th, 2025, a letter from the Congressional Budget Office, March 5th, 2025, and an article from the Kaiser Family Foundation explaining the congressional budget letter from March 7th, 2025.
Without objection.
Dr. Oz, I'm going to give these to you because you were asked a question earlier about cuts to Medicaid, not being aware, and I believe your response was something along the lines of not being aware of what House Republicans did. Here's some material to read that explains what just happened. So I'm going to share this to you as well. That's why I entered into the record. Now, Dr. Oz, rural hospitals are in dire straits. We've heard from Democrats and Republicans today. Now, they rely on Medicaid to stay afloat. Now, yes or no, do you support Medicaid cuts when they will lead to rural hospital closures?
I don't want rural hospitals to close unless we have a better option. But if I could offer a thought here, this is a good example where maybe there's an innovative approach that might work. I have been talking to hospital systems, and one idea that comes up in rural systems is they don't feel like they've got a partner that maybe is a larger academic center or a bigger institution that might have resources for them to do best practices exchanges. So imagine a rural hospital in central New Mexico, maybe around Mesa Verde, where you actually can have a partner that's in Phoenix or Salt Lake City or Dallas, and that could be your partner hospital. So when you need telemedicine services, they're there. They're not just there, digitally. They've been there. They know the institution. They know the people. They develop a camaraderie that allows them to thrive. We have to revisit how we deliver rural care in America. We can't depend on 100-bed hospitals that do one delivery a day to provide state-of-the-art care. So I share your concerns about losing these institutions. I think we should look at additional alternatives to make them strong. But Americans in rural areas, and I have heard it, even in my office visits from every single one of the senators in large rural constituencies.
So Dr. Oz, I'll ask a follow-up to Dr. Cassidy's question, or I'm sorry, to Senator Tillis's questions in conversation. Dr. Oz, will you stand against changes that will lower health outcomes to the programs that you will oversee?
Yes.
Should physicians or insurance companies dictate the care that a patient receives?
I'm sorry,
should physicians or insurance companies dictate the care that a patient receives?
Physicians.
I appreciate that. I agree with that. Yes or no, will you continue to defend Medicare drug pricing negotiation programs in court?
It's the law. I'm going to defend it and use it.
Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
I'm going to look, as the president has instructed to me to already, for every single way that we can reduce drug prices. And there are lots of options available. I feel compelled to pursue every one of them.
I'll ask you one more time, because I think I heard it, but I'll give you another chance. Yes or no, will you commit to the process of negotiating prescription drug prices in Medicare?
Senator, it's one of many approaches I want to use.
I appreciate it. I thought you might say yes a second time, but it's not yes or no. So from you, that's fine. Yes or no, do you believe that healthcare well, I already asked that one, Dr. Oz. Look, as we get through all of this, I have a series of questions that I have put together, not coming into this committee for, based on Senator Hassan's questions. I'll submit them into the record. I have a lot of concerns in these spaces. I won't get to it now. I appreciated having a conversation with you. I'm very concerned of this back and forth of my colleagues saying that they're going to not cut Medicaid or cut it, when Republicans are voting for it. Those are the realities. And as I shared with you, Dr. Oz, one thing that I've learned about Washington, D.C., the way that this place works better is when people keep their word, when people are honest. The American people want honesty. If it's bad news, they'll take it. And they're going to be stronger on how they're going to respond to it. But when they get lied to, and they think something's coming, or they're going to be protected, or a mom with a kid with cancer thinks they're going to have care, and then it gets taken away like that, then what? Just own up. If that's what you want to do, own up to it and admit it. But stop lying to the American people is what I keep saying to all my colleagues, anyone that will listen. God bless you and your family. I appreciate you being here today.
Thank you, sir.
Senator Warnock.
Thank you, Brother Chairman. Dr. Oz, welcome to you and your family. Congratulations on your nomination. I enjoyed our conversation the other day and finding out the friends that we have in common. My home state, Dr. Oz, the state of Georgia, is not only one of just 10 states in the country that still has not expanded Medicaid. It also has the dubious distinction of being the only state in the country where the limited number of families who do qualify for Medicaid are required to regularly complete bureaucratic paperwork to prove that they're still working the minimum number of hours to get health care. State officials call it Georgia Pathways to Coverage. I call it Georgia Pathways to Nowhere. The program is allowed under the state's Medicaid waiver, which is up for renewal this year. And if confirmed as head of CMS, you would be responsible for approving or denying the state's application to renew this onerous paperwork requirement. Dr. Oz, I'm not going to ask you to prejudge the state's renewal application. That wouldn't be fair. You need to see it. But since you would oversee Medicaid if confirmed, yes or no, do you believe that families should have to complete government paperwork every single month to prove that they're working just to get health care when they're sick?
Senator, I appreciate your question. I enjoyed visiting with you. My wife, went to Union Theological for a while, different time than you. I brought her as the support staff.
Good.
To make sure.
That gives me comfort. Yes or no?
The answer to me is I am in favor of work requirements, and I don't believe we should allow.
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove a work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid. However, I believe we would both probably agree that there's value in work, and it doesn't have to be going to a job. It could be getting an education. It should be showing that you want to contribute to society. Frankly, you could volunteer at Ebenezer Baptist Church, where I did a show with you once. That would, for me, fulfill the requirement.
You'll never get any pushback from me about the value of a work ethic and the purpose that work provides, which is why I think people ought to have health care so they can get back to work. Very often, they can't get back to work in Georgia because they can't get the health care. Let me give you an example. There is a woman in Dalton, Georgia that I got to know a while ago. Her name is Heather Payne. She's a traveling nurse. And, as a traveling nurse, some jobs were better than others. Sometimes she had health care, sometimes she didn't. She was among those folks who were in the gap. She couldn't afford private insurance, but she wasn't poor enough to get conventional Medicaid. So her health challenges and the unpredictable nature of her work as a traveling nurse made it impossible for her to meet Georgia's onerous work verification requirements to get Medicaid. She found out she had had a series of strokes. She had to save the money to see a neurologist. And then she found out she'd had a series of strokes. Took her a long time to be able to afford to go. And now she's in the gap. And she can't meet Georgia's onerous work requirements. Do you think Heather Payne, a traveling nurse who spent her career providing health care to others, do you think she deserves Medicaid or not?
Yes.
Thank you. I agree with you. And since we agree, I think that the Medicaid waiver that you will be responsible for reviewing, I think that Medicaid waiver, in fact, I know it, it says that Heather does not deserve Medicaid. Let me tell you about another Georgian. Amanda left her 2 jobs in New York and moved to Warner Robins, Georgia to become a full-time caregiver for her 84-year-old father, Thomas. Taking care of her father has become a full-time responsibility for Amanda. He's 84 years old. She's taking care of him, which means he's not in a nursing home, by the way. She's taken on that responsibility. But with all of this, she doesn't have time to hold a full-time job that meets the state's strict work requirements, and she has no income to cover her own health care costs should she get sick. Dr. Oz, do you think Amanda deserves Medicaid?
From what you're describing, yes. These are the opportunities we have to make the system better. If we both agree that people should be trying to get off Medicaid if they can, we should be able to create a system where we can track that, because there's the twin paradox, which I think we touched on in the office. 2 brothers are at home. One's working every day, flipping burgers, making minimum wage. Maybe he's cobbling together $16,000, $17,000, puts him right above the poverty level. And the other brother doesn't bother working because he'll have the exact same coverage if he doesn't work. We want to make both of them want to move up the ladder. Like every small businessman, what's their goal? To become a big businessman.
So look, you and I have the basis, I hope, for a meaningful conversation. Georgia's pathways to coverage is a roadblock to care. They've literally gotten, I don't know, 6,000 people, I think, the last time I checked. And we got over 500,000 people in the gap. So I'm gonna give you a softball. If you're confirmed, will you work with me and will you keep Amanda and Heather in mind as you consider whether or not to renew Georgia's waiver, which I think is filled with unnecessary and onerous work requirements, paperwork, filling out paperwork every single month? Will you keep these 2 people in mind? That's the question.
Heather and Amanda should be in all of our minds and many others like them. I look forward to working with you. Maybe if you'll invite me down on a Sunday, I'll come to church with you.
Thank you very much. You're invited any Sunday.
All right.
You can't preach, but you can come.
Senator Welch.
Thank you very much, Mr. Chairman. Welcome, Dr. Oz, and welcome to your family. The big concern I have about our healthcare system is it costs too much. It's a real disgrace that we spend the most and get the least. I mean, so many other countries, with all the problems they may have with their healthcare system, citizens are not anxious about whether they can afford the care that they need. Here, that's not the case. And one of the big problems is that private equity, pharmaceutical pricing power, device manufacturer pricing power, consolidation in the industry, all of this has made the cost of healthcare brutal. It's brutal on taxpayers. It's brutal on employers. In Vermont, we have a lot of small employers. They're paying sometimes $40,000 for a family plan for their employees. They can't afford that. And it's brutal, obviously, on individuals. So I believe a major responsibility that you would have in your job would be to fight the excessive charging. I'll ask you a little bit about pharmaceuticals, but you said you're going to pursue that. In his first term, President Trump said he favored a reference price for drugs. So, we're paying 3, 4, 5 times for the same drug that they buy in Canada or in Europe. Would you support reference pricing so that we don't get ripped off compared to everybody else, even though we do the research?
Sarah Welsh, thank you very much for taking time to meet with me before this event and for that question. President Trump has been very clear that he wants me to reduce drug prices, not just that the government pays, but also for beneficiaries. International reference pricing is a way of doing that.
All right, here's what I think we all need. We have got to get a fair price, and it's not a fair price when we're paying 6 or 7 times what they're paying for the same thing in France or in Canada or wherever else. Okay, so I'm just going to stop here, but say that is absolutely top of mind. President Trump has indicated a concern about this, and I hope you follow through. Second, Medicare Advantage, it sounds good, but it's an incredible ripoff in some cases. The Wall Street Journal did a expose, incredible investigation about what United Healthcare did. And what it found is that they packed diagnoses. It was to their advantage to have a person seeking Medicare Advantage to have numerous diagnoses that really didn't necessarily require treatment. They provided doctors and nurses